Good afternoon, guys. My name is Irene. Welcome to my live stream discussion for today. Our topics is about sharp disposal and sharp management. And this is conducted by Infection Prevention and Control. And I will prepare first my attendance. Session date today is July 12. And our first topic is about sharp disposal. Yes, doctor, come and have a seat. This is your attendance. We are waiting for the others, doctor. This is our topic for today, sharp disposal. Yes. And the next is the sharp management. And then I will explain to them the how to fill up the form of the needle prick injury.
Needle break?
Yeah, if they accidentally prick, and I will give to them. They are coming, but they said they may be late. I can discuss that to you ahead, and then when you will come, we will catch up now for that. Okay. Yes, yes, yes. It's okay, doctor. Anyway, they can. It is recorded, so no problem for it. Even they can rewind it. Okay. We will start on the sharp disposal, doctor. This is our sharp disposal. How to the proper segregations. It was said keep your community safe for the use of a sharps container. It is said do not throw those sharp in trash. Do not put the sharp in recycling. Do not flush sharps down the toilet. And then keep it out of reach of children. Sit down. By the way, Mr. Amir, is upstairs, but he was with us on the live. He knows this. And disposal, what do you mean by disposal? Disposal is the correct method when you dispensing any sharp objects. Sharps, the sharps waste, and biohazardous waste, the syringes, injections devices, the blades, razors, scalpels, scissors, and knives. And then contaminated glass, tube or container. The purpose is to prevent what? Injury and exposure to blood-borne infections for personal handling. Sharps including needles, lancets, syringes, knife, blades, and open ampoules of medications. This is to effect a significant reduction in the incidence of needle stick and cut injuries which have a potential for transmitting blood-borne pathogens. To safely handle all material unit, they can be properly disposed. Here are our policy. Sharps and needles are collected in dedicated puncture-proof containers that are not reused. Needles are not bent, broken, or recapped except in special and approved circumstances. If recapping is necessary, the scoop method is used. Yeah, that's the scoop method. Place the cup on a flat surface. Just a minute, doctor. I put in the group. And then without holding the cup, use the needle to scoop the cup onto the needle. And then shake the cup down over the needle. Press the cup firmly into place. Avoid hand-to-hand passing of sharp instruments. The policy for this, sharps containers should not be overfilled and should be located in a secure position and not on the floor. It should be wall mounted. And this, the mounted, wall mounted, like that, this one. We don't have yet this. The available one is that one only. But inshallah, we will request for this small. People using the sharps containers should have a clear line of sight visions of the tops of the sharp containers. And then sharps containers should be changed whenever they reach the fill line. Nurses shall check on the fullness level, 3-part, and the availability of the sharps containers upon the start and toward the end of the ship. Hazard warning labeling should be applied. should be labeled as sharp waste and biohazardous with international biohazardous symbol. This is the symbol. That's one. But we have this one. Yes, this one. When sharps containers are three-part, they shall be securely sealed and tightly close the lid. The housekeeping unit shall be responsible for collecting sharps containers. The unit staff is responsible for replacing them with a new one. See, it is said uh, responsible is the unit staff. Here are don'ts. Do not hold a sharps container at the bottom of the contents compartment. Hold it near the top. Do not shake a sharps container and do not wipe a sharps container to clean it. Then thank you. The next is our sharp management. Yeah. Stay safe. Stay safe and get rid of sharps. Okay, next is our sharp management. Sharp management and sharps and needle break injury. Yeah, that's one. The sharps management purpose of this to minimize the risk of hazardous sources in the hospital and prevent its transmissions among patients, healthcare workers, and the environment itself. To avoid accidental occupational injury from sharps and waste. And then to promote awareness of each healthcare worker's responsibility in the safe management of sharps. The definition of term: any object that can penetrate the skin. Sharps include needles, scalpels, and broken glass. A puncture-resistant, leak-resistant container designed to hold used sharps safely during collections, disposal, and destruction, sometimes referred to as sharps box. That's for our sharps container. Yan. The act of replacing a protective sheet on a needle. Recapping needles using two-handed methods increases the risk of needle stick injuries and it's not recommended. However, which such action is unavoidable. Sorry. The one-hand scoop technique reduces the risk of needle sticks. That's the recoupling. So, all sharps are considered regulated waste. Disposable syringes with needles, scalpel blades, scalpel blades, and other shall be placed into puncture resistant containers located in the area of use. Needles must not be recapped purposely, broken, bent, or otherwise manipulated by hand. Recapping is absolutely necessary. Use what? The scoop method. Disposable needles and syringes are considered as unit and not separated and shall be disposed as a unit. And there is a policy for this. Assembly is required. If this assembly is required, the needle shall be separated from the syringe using the nuts on the top of the puncture resistant container. Use of the notch allows the discontinued needle to drop safely into the container. The sharp containers shall not be reopened once they are closed. They also not be in any other manner that would expose the employees to the risk or percutaneous injury. Do not keep syringes, needles, or any other item in your pocket. Our policy. Never leave sharps lying around. Dispose immediately. Replace sharp container when the container is three-quarters full and managed in a secure manner. Sharp containers, while being in use, shall be kept away from pathways, usually above the level of the floor. That's why there is a measurement above the floor. The scoop method. It's very important for the nurses, doctor. So this one. Yes, the scoop method. That's why they got injury because how to yes how to properly use it. And the step one, place the cup on a flat surface, then remove your hand like this from the cup. Yeah, the second with one hand hold the syringe and use the needle to scoop up the cup. See? Then number three, when the cup covers the needle completely, use the other hand to secure the cup and the needle hub. Be careful to handle the cup at the bottom only. Disposal of sharps. There is procedure. When sharp containers are three-port, they should be securely sealed by HCW, means healthcare workers, and secure the lid with tape. Put the sharp containers in yellow infectious plastic bags sealed with plastic cable. Label with date, unit clinic, initials, names of nurse. See, they are already mentioned the nurses. Initial names of nurses, the ID number of the healthcare worker. The container shall be picked up by housekeeping staff with other biohazard dose waste all to the waste storage room. Yeah, that's our sealed with tape.
Can I see
Report.
the before slide معلش دكتور
Okay.
Can I see the previous one?
The previous one?
Previous one.
This one.
This is here معلش.
Yes. See? When shards triple, it's lasting for the cleaner. This message, this securely sealed by the healthcare, even the nurses. Secure the lid with tape. Put the shards containers in yellow infectious plastic bag. See? It was highlighted. Yellow infectious plastic bag. Sealed with plastic. That's why nurses are important. Even only one for the head nurses. Enough. That's it. Label with date, unit, clinic, initials, names of nurse, and ID number. So this is the proper.
Why
Yeah.
there's this cleaner?
Yeah, no, the label only, the labeling. But it's not said that the nurse will, the one, only the label. She is the on the right, especially in the area. It's our policy that's why. Because only labeling. Okay. If the example, the nurse in the area, who should do it first? She is the one responsible to call the cleaner. So if she call, You must write the level like that. And then put in the cleaner, the one who will segregate. Okay. Okay. Facilitate, three-fourth, always three-fourth. There is leveling measurement. I know that. Very important. And tomorrow, doctor, is my housekeeping meeting start tomorrow. And I told to Mr. Shahin this morning, after that, we will go rounds in each room of the ward. Because I do the checklist today for that each room. And Mr. the one become the surveyor every day, the MOH surprise, the yes, yes, yes. He was asking for this. And he was asking also Shahin. So I revised the old checklist. And then I told to Shahin after we are meeting, we will go around all rooms in the wards and we will put the checklist so that I see it. Inshallah po. I know already. Hmm. Date disposed, name of the nurse, unit need, number. That's it, doctor. It's easy. Sharp and needle prick injury. The purpose to equip the staff on the proper course of actions, cases of exposure to blood and blood-stained fluids by sharps and needle prick injuries. And now we have more nurses. That's why I need them to hear. That's why they know, especially the new one. Yeah, I already talked to them before 2 days or 3 days like that. They know already. Come, Doctora, have a seat. Dr. Soher is with you. This is our new consultant doctor from the laboratory. Just sit down there,
I'm
Doctor.
so sorry.
Oh, it's okay, it's okay. Just sit down now.
Someone
Yeah, yeah. Anyway. And then the definitions of terms. The blood or body fluids. Blood cerebrospinal fluid, peritoneal fluid, pleural fluid, pericardial fluid like that. Blood. We will discuss this. Sharp injury. Exposure to blood or body fluids caused by laceration, puncture of the skin, bite, and scratch by a sharp. Sharps includes needles, scalpels, broken glass, or other items that might lacerate or puncture your skin. Policy to reduce the risk to employees, volunteers, patient visitors, and contractors, and those affected by their work practices of contracting a blood-borne pathogens in the workplace. In case of needle stick or sharp injury, apply first. See, they reminded this also for the nurse. Immediately wash injured site with soap and water. Allow site to bleed freely. Wrap the wound with sterile gauze. Because the last time, I think 3 weeks ago, last 3 weeks ago, Doctor called me because he got pricked in the OR. And he just asked this first aid. He just and proceed to the emergency room for immediate treatment appropriate to the injury. And the treatment must include examination, screening, infection prophylaxis, wound care. Treatment must be documented in the employee's medical record. Attending physician shall order screening of the source contact. This is the one. This is the one. You have our form that available in my office. This is the one. If you have needle, stick, sharp object injury report, example, you got prick, I will give you this form. I will ask you regarding what type, because number one, you will have your the first name, and then your department, the home department, and then this is Arabic English. There is Arabic, there is English bus, and this is Arabic English. Now after that, there is some question here. It's very easy, very easy, very easy, and then surgical instrument and other sharp items. The name. And this is important. What portion, what portion of the sharp injury you have? Like example, mostly here, not so deep, only minor, just like that, just on the. And that's why you will circle what type of portion, what type of the abrasion you have, puncture site here. See, there is a level. What we have before, the example one is syringe in the lab during extraction of blood. I think the last year she had like this. And we need this because every survey they ask this: do you have post exposure? And then the blood and body fluid exposure also reported. We have also this is injury. This is the blood, especially in the lab. And this we have separate one from the OR department. This one. And they will ask this in the date of injury, of course, the surgical service, surgical procedure, like that. There is question. And it was asking your laboratory history. Do you describe like that, doctor? I will tell you. What the category, the injury of the worker? Next question. Where did the injury occur? Example, OR. This is all for OR anyway. And then, was the source patients identified? At the time of injury, the sharp was. And then, for what purpose they have also. And next is, what type of device? See, it's complete. It's really complete. Any action must be documented. Yeah, it must be documented. And then you have post-exposure follow-up. Exposure follow-up like this. You have post-exposure follow-up like this. Exposure follow-up. And then injury for it's separate OR and then it's okay. Next, that's why I mentioned here. I will give you this then. Then the procedure. Emergency room must inform department head, supervisor, infection control, and physician. The ER must complete the occurrence bar, the hour of BR as per policy, including precise description of how, where, and when the injury occurred, follow-up treatment, and the description of involved sharp procedure. Any contamination following needle, stick, or sharp injuries requiring long treatment must be indicated. The ER must forward the OBR to the disease variance report to the infection control physician for completion. Then for recommended, we have the staff health physician for infection control is Dr. Marwa Kamal. For recommended post-exposure prophylaxis, refer to occupational exposure policy. Then apply first aid, go to ER for treatment, then fill up OBR, then inform supervisor infection control, and then follow up treatment, the screening. Thank you. The next will be the last one. The last one, it's the blood body fluid. Last is the next. I already discussed it, Cora, but I will tell you about then, huh? Because it's already discussed in the ahead of time. Anyway, so only this one. Yeah. This is your blood and body fluid spill management. I included now, right? I included this, but supposedly it should be two topics, but I include na this, so that's we'll finish today. That so that in next week another topic discussion. By next week will be surveillance. So we will include the HACCP, and then I will inform you regarding the what's our communicable diseases that I will show you here the report for the how the form how to report it. And this we have purpose. This policy is intended to provide guidance to staff safely and effectively manage spillages in the hospital. The policy is for all staff working that month and the course of the routine duties be exposed to blood in body fluids. All patients areas must ensure that they have a spill. We have spill kit here. All. You have also in the labs, Doctora. I see it.
Yes.
Yes. But I think I need to request again because not so. And then the spill kit available in the clinical area. Yes. Yeah, spill kit. Last in. All staff should receive training in the spillage management and appropriate equipment must be available. And next time, the definition of terms. Spillage in contamination of the environment by blood and body fluids, excreta. Spill kit is a pack that contains all the essential equipment for dealing with spillages, including PPE, your personal protective equipment, and cleaning materials. Body fluids include the respiratory and oral secretion. It's mainly, so it's general secretion like that, etc. This urine, wound drainage, cerebral kind of fluid, the aspiration. And then the abraded or intact skin. Wash skin with soap and copious amount of water. See, they always mention if you do you will always fill up first what the OBR. You just right. And then we are welcome to submit your OBR to our Dr. Ahmad quality. He was waiting for your if you have OBR like OBR report for the OBR report. Then inform supervisor and infection control. Of radded or non-intact skin, apply first aid wash skin with soap and copious amount of water. Avoid scrubbing with brush. Do not use, of course, do not use disinfectant. Same method. Go to ER, fill up OBR, inform supervisor or infection control to us, and then follow up on treatment. In the eyes, first aid plus the area, gently but thoroughly with running water or saline for at least 15 minutes while the eyes are open. See, again, the same method. Apply first in the nose or mouth. First aid, immediately spit the blood or fluids and rinse the mouth with water several times. Blow the nose and clean the affected area with water or saline. Do not use, again, disinfectant. Same method of the next step of 2, 3, 4, 5. Spillage on surfaces on other than the skin to protect personnel and patients from contaminations. And blood spillage on hard surfaces must be properly cleaned immediately, and then dried blood remains infectious for several days. Now, just read this. It's very the start and the blood and body fluid management. Anyway, this is recorded, Doctora, so you can browse it in the start. Place the caution. Yeah, the number one is place the caution. Then prepare the spill kit, wear PPE. Then the next step is here. Then wait for 2 minutes. And then wipe the spill from inner to strongly disposed. And every spill kit, you will not lose. Why? There is a reminder that there is a content there at the back and how to manage it. Every spill kit. Then you just guided it by company, they provide it. all spill kit they have. Yeah. Blood and body fluid spillage. Follow blood and body spill management flow chart. Fill the OBR and then inform the supervisor. Sing. This urine must be mopped up with paper towels first. This is concerned for the cleaner. Anyway, at least you see it. You can tell that to the cleaner. You can remind the cleaner. At least you know you should must be aware regarding, even you are not the one who doing, but you are aware of doing of your colleague, of your co-staff, like the co-employee, like the staff, like the cleaner, the housekeeping. Followed by cleaning with detergent and hot water. The room should be well ventilated before this procedure is carried out. Materials and equipments: the glove, the plastic apron, the mask, the goggles, the eye shield, the head cover, foot cover, the tongue, the sprayer or prayer bottles, leak for color coded infectious waste bag. Thank you. And this is our today for Doctora. You need to sign this one.
شكرا دكتورة. شكرا. شكرا دكتورة. شكرا. شكرا.
Anyway, I will report this to HR that you are a good participant, participant of the suffer without glasses, right? That you can extend it. And then I have something to review. Also, I want you to send to me any infection control related to the laboratory. Yeah, to my email. Okay. And then you need to yes, Doctor. Yes. Then just down there. I will. Yes, I will. I will give you some pointers. Sit down there. There's another for the lab concern. Did you finish the doctoral, our uh, antibiogram antibiogram report?
What?
Antibiogram
Yes,
project.
yes.
What Paja told to
I
you?
asked Dr. Fadia,
Uh-huh.
responsible from the Department of Microbiology,
Mm-hmm.
said to me, oh, okay, we'll record all the microorganisms and sensitivity tests from the beginning of this month. Okay, and from 1 July till today.
And
Or are you want previous all months?
yes,
Or
because
just this month?
no, we need to have at least 3 months, doctor.
3 months?
Yeah, but because
Okay, I will try, inshallah.
because this is for our documentation record for the
Because
that's the last
yes,
one.
before this time not make not made in the lab.
Yeah. Inshallah.
No problem.
It's okay.
From,
It's okay.
يعني from now to next days, that to make this record daily. Or
Yes.
weekly, inshallah. Weekly or daily.
After this, I will come to you down in the
Yeah,
so that yes, I need to check your
Because
Faja
too
is
much, too much.
Faja is available now. She's
Yes, in the
there.
lab.
What time she will go?
Time?
Yeah.
At 3 o'clock. Friday will be
3 o'clock.
3.
3 o'clock. She will go. You already finished your doctoral, huh?
What?
On Thursday, huh? Don't forget.
Inshallah.
We have meeting for the
next Thursday, from this month just, but next week also. Okay.
okay.
Previous 2 week. Okay.
I will
This
endorse.
month.
I will endorse you to our national
Yes,
level.
this month
Yes.
from 1 July till now.
Yeah. I will endorse you in our
Because previous 3 too much.
Yes.
Work.
I will endorse you in our the one I told you to our national level Minister of Health for the laboratory, as you are the one now coordinator for it. The
For
head
what?
for the head of the laboratory. They asked me before because Dr. Mona go, so I need to just
Who asked you? Ministry of Health?
the from the what's this from infectious disease, communicable diseases. That's
Mm.
okay, doctor. I will come to you because I did not bring some of my and this is the one also for our staff. If you have, you also have disclaimer. If you don't need no, like this.
Okay.
Like this, like this. Yes, disclaimer like that. You will be like this. Then here is some medical program, screening, the vaccinations, and the antibody titer, diseases. Also this vaccination, yeah.
And this about
The screening immunization program, like the test hepatitis B screening.
hepatitis.
Example that only in the south, in the take the vaccine,
Ah.
and then you will be responsible to sign this because it affects
One times in the Kidai.
the surveillance
One times.
control.
Or every 10 years. Hepatitis B vaccine. Take. Yes. Must be take every 10 years.
Hmm.
Or one times.
It's we have yearly screening for this.
For example, I took
Yeah.
three doses. Yes.
We will then discuss that topic.
More than 10 years.
It's okay.
Ah.
We will we will have another text.
All members of the lab.
I will give you this and I will talk to you later. Okay, that one is the one, but we need to prepare by because the committee on the Thursday, our committee. For this is
Thursday.
huh?
But the previous 3 months, we can't. From 1 July till now.
Because I made under
After what?
So, this, if you do this report, then those passing for previous months also. And then the important is the hazard. I will open to you here. How to open it. This is additional for you. I'll just open I will open my password here. The other one. Oh. Yes, it's open now. Now we will go to this one. Just type the portal, the Health Electronic Surveillance Network, and then see, you sign in. And then let me see this. Okay. See, this the investigations, the COVID-19 hour, the report, the positive cases, like that. And we have this one, this one I mentioned, the serial reporting is every Sunday submission. Every Sunday. So it looks like this. Yeah, that's it. But I will not submit because it's not the date. You just only see the how it's you have ensure that no confirmed case of diseases. This is our communicable diseases cases. Yeah, like that. And then they will see your null because it's not ano. Because you finished na the last submission. Yesterday, I did this all.
Yesterday?
Yes, every Sunday. And then by next Sunday, I will come to your laboratory and then I will learn you how to submit this. Then you will see all the
Every Sunday?
yeah every Sunday, and then it will appear if what we have case example. If you have question, you will go directly here, and then if you have concern to clarification, you can email them. The last time I did because there is complaint that why we have many laboratory requests like that, print like that. So if you need to change the password or like this, you just email them, and then they will see you. They will ask you regarding your signatory name. It's easy. And this one, there is two. See, and this one, name Arabic or English. You can apply. And then next, in the report dashboards, this see, this is the one, the positive cases also. Yes, they mention your lab reports. And that's one. Anyway, this and there is Dr. Rossi. We have training manuals here. So if there is available, you can see. Oh, the blood banks. So, oh, this is infection control. The microorganisms training manuals. I don't know if this they don't have manuals here. And then we just will try not available. And this one. And then now cholesterol. And then there is the other side. Just same. We will plug in. Oh, not available means not yet because sometimes the site is not working. And that's it. Now you look about this one. If you have case some communicable, this is the one. Okay. I will come to you and to give you the copy. But this is only one copy. So then I will
Which
come,
paper?
yeah, I will come to you with some copy for your stuff. Yeah. You just have one file for in some forms. What forms do you need?
Forms?
Yeah, you need something another. Or, you have a complete forms that you have request like that. The last one I, the last one I show you is the last meeting that we had. The last one that is the for that's one thing that I show you is every end of the month. The last report. The every that one. And there is every everything also. Every I will I give you some word for this. The important one for and the open of that one is the they were not ready. Some all the stuff is new, but some of them already were sharing to other because they are doing the language especially to receive the time. But what you have complete forms that they you have that in the any forms. So, anyway, I'm told for that one. For me, but we can really bless you. So that we will not be able to have our business. And, that's what we are doing.
This in a form needs to be put in the file.
Yes,
Yeah.
this is for, yeah, this is for staff. This is for staff work here. I want to play with it. But the file is not staff health and ecological post. It will put in the our ecological. Inshallah, don't forget Thursday, 1 p.m. Um, don't forget Thursday, our
This completed anti-vibrant.
Yes, Doktora. Don't forget our committee meeting. You are very important. You need to attend. Uh, on Thursday, 1 p.m. I already informed the quality director, the one coming, Dr. Ahmad Kam, and she also come. He also come this morning to my office, and he told that he regarding this antibiogram. I said it's work. It's ongoing process. Going
Alas,
at
I
least.
will
Yes, Doctor. Thank
I
you
will
very
work
much.
with Dr. Faida to complete this anti-vibrant,
Yeah.
inshallah. But from 1 July, okay? Because it's too much work, yeah. And it's a lot. Huh?
3 months.
3 months?
I will try, inshallah. I looked at days to write. Mid of June. Okay.
Same TV program to enter the data here.
No,
It's the same.
or the Excel. It's already there. You can
Yes, yes. Write all this antibiotic and same.
Yes, yes. Just ask you to learn how to format,
Yes, yes.
That's the format of it. And because you are the one who will put the date, it's not the
Yes,
so it's not the date. Anyway, just ask this like this format and then you got it.
This form is ready in office of
No, no, no. Even in my honor, because this is given by the forum, one of the not clear that they only I don't know who give the first one.
Like I will send you my computer.
Yeah, yeah.
Maybe present.
Yeah. Because the forum only
We change the date.
Yes, of course, yes. You change your but this is to be this is you need father this, and then you just insert. Actually, you just accept put in more or just as a one you will not appreciate because they just because it's not right. Very good. And there is this he will also ask you so that you are prepared ahead of time so that you are not late also. It's very important, not only for the
Kasi nakita ko paper. Paper for July and paper for June.
Hindi na para
Okay. Okay.
yes.